control panel. The broadcast is now starting. All attendees are in listen-only mode.
Eugene, can you hear me? Eugene, can anybody hear me?
Hello.
Hi.
This is Donna.
Hi, Donna.
Hi, how are you?
Good.
Good.
We're just trying to get everybody on. That's Eugene. Hold on. Hi, Eugene.
Hello.
Oh. Yeah, I can hear you. Okay, let's see. Audio. Yeah.
Oh, hello. Tinka or Eugene, can you hear me? This is Shannon.
This is Tinka. I can hear you.
Oh, great. Okay.
I had to unmute everybody.
Oh, gotcha.
So I'm not sure what's
Welcome to the webinar. You have entered as an attendee in listen-only mode.
In listen-only mode.
Let's see. Your attendee is self-muted and is muted by organizer. Unmute. Did you?
Would you be able to press the slides and advance them if you share it?
Sure. I think so. I don't have the slides, though. Are they in here? Oh, okay. Let me mute myself. Hold on. I don't know why, but attendees is self-muted and is muted by organizer. Did you log in under me, Eugene?
Yes.
Oh, let me see if I can find me.
Did you mute topics are still on.
All right. Can you talk now?
Yep, I'm unmuted now.
Okay. You should be able. Do you want me to? I'm gonna hang up here.
Okay.
All right. So I guess I should pull up the slides then.
Yes, if you can.
All right. And it's under 450 under what?
So if you go to 450, there's GP Regional FluFIT webinar.
Okay. Is it just under FluFIT?
Yep, if you go to FluFIT,
Okay.
you see GP Regional FluFIT.
Yep. And I got the PowerPoint.
Did you find it?
Huh?
You find the PowerPoint?
I think so.
Okay.
Hold on just a second.
Hello, this is Viola. Can you hear me?
Yes, I can. This is Tinka.
Okay. Hi. Do I have to sign in somewhere or just that I'm good?
I think you're on and you should be good. And I should.
Okay. I saw attendee list and I didn't see my name on there. That's fine.
Yeah.
Okay. Thank you.
Shannon, are you still on and can you hear me?
Yes, can you hear me?
Yeah.
Perfect.
All right. So it sounds like I will present or actually move the slides for you guys. Let me see. Okay.
On my phone?
So are you able to share your screen,
Yeah.
Tinka, with the slides?
Well, that's what I'm trying to find right now.
Okay.
Do you know where that's at? Screen, here it is.
Wait, what?
And it is gray. Let's see. I'm just going to make me the presenter, show my screen.
Oh, that says delete account.
Can you see my screen?
Oh, okay.
Right now we see a dashboard.
Okay.
That says delete account.
Hold on.
Shannon, this is Betty. I'm on as well. Are we supposed to have our camera on?
And what am I typing in here on the screen? Apps that signify help.
If you
It's up to you.
are not speaking, can you mute, please?
Hi, Betty. It's totally up to you if you want to or not with your camera.
Okay.
Tinka, you have your desktop pulled up. There you go. There's the PowerPoint. Perfect.
So let's switch. Hold on just
Yes.
a minute here. This has got to move out of the way. And which one is it? Display settings.
If you go down on the
Is that-
bottom. Yep. There you are.
Okay. So it sounds like you guys that I will have to push the slideshows for you. So if you could just say next slide. And Eugene, you can go ahead and you and Shannon and whomever can go ahead and moderate and I will be quiet.
All right, sounds good. Thank you all for joining us. We're going to give it maybe like 2 more minutes for people to join in on our webinar. So if you can be patient at this time, and if you have the option to go ahead and mute your camera so that there won't, or your speaker, so that there won't be no interruptions.
So just an FYI, Eugene, it is being recorded now.
Okay, sounds good. I was just going to ask about that option, so thank you, Tinka. FYI, for those who are just now joining in, that we're going to wait a couple more minutes for people to join in. So if you can, mute your speakers, your microphone.
The other thing, this is Tinka. I do have the chat box pulled up. You'll see Shannon said, "This is Shannon, but I'm on mute." And I can hear you. I'm going to go ahead and delete that. Okay. Back on mute I go.
All right, so I think we'll go ahead and begin. I want to thank everyone for joining us for our Great Plains Regional FluFIT webinar. So just a background, I'm the program manager for the Great Plains Colorectal Cancer Screening Initiative, and I reached out to the American Cancer Society, ACS, with Shannon Bacon to partner with different initiatives and facilities and programs that are implementing things with colorectal cancer screening and in regards to FluFIT. So we'll go ahead and begin. Tinka, if you want to advance to the next slide.
Yeah.
Hello, Tinka. There you are. All right, so this is just the layout of the agenda of what our talking points are going to be today. Shannon Bacon will do the introduction, and then we'll follow up with the Turtle Mountain Band of Chippewas with Donna Lunde St. Clair on their tribal FluFIT implementations and initiatives, and then on with Spectra Health, and finish off with our GP-CCSI FluFIT toolkit. Next slide, Tinka. All right, so we'll go ahead and turn it over to Shannon Bacon.
Hi, Eugene. Can you hear me?
Yes.
Perfect. Okay. Hi, everybody. This is Shannon Bacon. I'm with the American Cancer Society based in North Dakota. And I know I have lots of ACS colleagues around the region on the line today as well. And Eugene asked me to just give a quick introduction to FluFIT, so we can do that. I think a lot of you on the line are probably familiar with FluFIT, and some of you have probably even implemented it in the past, but we'll just do a quick level set on what it is. So FluFIT is an intervention that's really designed to increase colorectal cancer screening by integrating take-home stool tests with the patient visit for an annual flu shot. So you may have patients who, don't come in for that annual well check, and yet they come in for that annual flu shot. And so it's really just an extra chance to catch them while they're in a prevention mindset and to maybe integrate in another preventive opportunity for them. It is recognized as a research tested intervention program, or RTIP, by the National Cancer Institute. So it does have good evidence supporting it. One thing to always keep in mind is that it's of course appropriate only for average risk patients. So we do want to always have that risk assessment process in place. And I think one of our presenters is even going to speak to that a little bit. And then the other thing we've learned over the last few years, a lot of partners across our region have implemented FluFIT, and oftentimes we have found that it's not a one size fits all, even though there's a lot of best practices and good learnings around how to implement it. You'll see that a lot of the FluFIT materials might frame it up as more of an event or a blitz, which can work great. And then we've also seen some partners simply integrate it into their regular office visits, which can also work great. So, you can kind of think about how this works for you. One thing we will say is that we've seen a key to success really be have a good process for tracking and following up on those stool tests. And so I would say that's really the first place to start if you feel like you don't have that yet. And I know that Eugene or me or others from our organizations are happy to help think through that if you're needing some help with that. So next slide. And then we just want to acknowledge we are living in a very unique and challenging time. And so thinking about FluFIT specifically in the era of COVID, experts are warning of potentially a flu-COVID collision, which is really concerning. And so that widespread influenza vaccination is probably more important than ever this fall. And then at the same time, we're seeing this really dramatic and historic decline in colorectal cancer screening that we also have to keep our eyes on and be looking at how do we address that. There's a graphic I just did a screenshot of here, and this comes from the National Colorectal Cancer Roundtable, where experts are already projecting in excess of 4,500 deaths from colorectal cancer due to the COVID decline in screening. So when we look at FluFIT, we really just see it as an opportunity to address both of those things at once. And to really promote flu vaccination this year, knowing that that's so important, and also to get back on track with colorectal screening. Next slide. So Eugene is going to dive into more resources and implementation tools later in the call, but I wanted to just include some links here, and I won't talk through each of these, but you'll have this slide deck available so that you can look through this. All of these links are from flufit.org. So I always say that's a great place to find a lot of implementation tools and supports, and there's lots of great stuff out there. Next slide. And then lastly, we just want to acknowledge that the FluFIT materials that are available do reflect the U.S. Preventive Service Task Force screening guidelines. So a lot of you know that in 2018, the American Cancer Society did make the decision to lower the recommended screening start age to 45 because of the increase that's being seen in younger people. And of course, insurance typically follows USPSTF. So we know that in most practices, the start age in practice is probably still 50. One thing to keep in mind is that most stool tests are relatively inexpensive. The stool DNA test would be a little more spendy, but a lot of the standard FIT tests or IFOBs are relatively inexpensive. And so if a patient was choosing to start at age 45 and pay that out of pocket, it would be a lower cost than starting out with colonoscopy. So just something to think about. And then we know that the task force is reviewing their own guideline and will be updating that probably within the next year. We never quite know exactly when. It's a very lengthy process. So we'll definitely be watching to see if the U.S. task force does lower to 45, and we'll keep all of you in the loop on any updates that we hear on that. So Eugene, I think I will turn it back over to you.
Thank you, Shannon. You can go ahead and advance forward to the next slide, Tinka. And also at this time, we will still save all questions till after the presentation. So at this time, I'll turn it over to Betty Housey.
Hi, I am Betty Housing. I'm the clinical director for Spectra Health. We are a community health center. We are located in Grand Forks. We also have a clinic in Larimore. So just a little background. I've been with Spectra since 2013. So I'm going on just finished my 6th year, going into my 7th year, I believe, 2014, maybe. I'm losing track of time, but you can advance to the next slide, please. So when I first started, we talked a lot about the FluFIT, and one of the recommendations was doing those blitzes and trying to get those taken care of and seeing if we can get out in the community, not only to we used to be known as Valley Community Health Centers, so some of you guys may have known us as that, but getting our name out there since we just opened and those kind of things. So we tried about 3-4 years ago to do a blitz at one of our assisted living centers community centers in our community. There was 2 of them, and we tag teamed with WellCore that does the flu shots. And so one of our practitioners went out and with the FIT kits and sat with the WellCore gal and tried to get patients to come over and talk to them and discuss colorectal screening, et cetera, et cetera. And what we found was the patients there were all gung-ho to get their flu shot, but didn't want anything to do with the colorectal screening. They would not talk to our providers, would not take even a pamphlet that described what it was and all of that stuff. So when that came back twice, we decided, well, let's try something different. And so what we did is we implemented kind of like a screening process, and then we started doing them basically within the clinic whenever anybody came, but really targeting during those months that the flu shot is given, which is usually, starting in September, given through probably March or April, somewhere in there, depending on how long flu season lasts. And so that's what we kind of decided as a team within our health center to do with both clinics. So what we ended up doing is kind of designing this process that you see before you right now regarding kind of the steps to do that, mainly for consistency and because it involved different departments. So it involved like our nursing staff, our providers, our lab, our front desk. And so we wanted everybody to know kind of what their place was within the screening process so that we're able to increase our screening rates. Obviously, overall, that's what we would like to do. When I first started, our screening rates were not good. They were 20s, 30% that we had been seeing. And last year, I think we were at about 42 or 43%. So they're not great, but we've definitely in the last 6 years have come up quite a bit. And that has helped with the screening process. So one of my recommendations, if you're going to start this, is to develop this process. It doesn't have to be obviously the same as we did, but whatever works for your clinic, your health center, wherever you're at. So what we did is in our pre-visit, meaning the night before, the day before, our nursing staff preps their charts for the next day for our providers. And so what they would look at is different things like basically, why are they coming here? So we want to, if they need labs, are there other things that we look at? And then we started adding preventative health in there. So we're doing cervical, breast, and colorectal screening. So are they due for those? And if so, when was the last one? Or when did they have this and that? So that's where we started putting in where they were for FIT test. We moved our FIT test out of the lab and put them actually in our exam rooms. Now with COVID, we've had to tweak it a little bit where we can't have a lot of our supplies out just to keep a lot of hands off. So what we've done is just put them in one of the drawers that are in the exam rooms, and both the providers and nursing staff know that they're there. So so what we would do that is kind of scrub the schedule and look to see who would be due for FIT tests and kind of highlight that. So then the nurse that was working with the provider the next day would be aware that these are different things that we need to cover with this patient at this visit. And then the other part would be then again, the provider or the nurse giving them that FIT test that's in the room and going through the instructions and going through the things that they were able to do. One of the first things we would ask them is if they would be able to do the specimen while they were here and just be done with it. Because a FIT test is one time, you're done with it for a year, then you're good to go. The results come back in 20, 30 minutes, and then because we process them within our clinic. And so if they weren't able to do that, the POD, what it stands for is poop on demand. And that was kind of a little thing that one of our providers and all of us kind of got together is their names could go like in a gift basket, and we would be able to give them like their names in there if they were able to give that specimen that day. And then we do a drawing and they'd get either a gift basket or like a gift card. So kind of giving that incentive, because we all know that nobody really wants to talk about that, but it's something that everybody does. And it's becoming now a little bit less stigma to it about talking about what colorectal screening is. And a FIT test is so much more less invasive than having to go to the clinic and having a colonoscopy where you are under anesthesia, even if it is mild or moderate, but there's more risk to that than doing the FIT test. And so the other part is we developed these postcards, which I'll show you in a little bit, a couple more slides, is what we had the patient do is fill out their name on there. And so if they weren't able to do their specimen at that time, they would take their FIT test with them, and then they could either mail it, so we could put postage on there, or they could come back and drop it off at the front, or when they came back for the next appointment, they could bring it with. Whatever worked well for them, that's how we would do it. And then what we did is we would take the postcards and put them in the lab, and then lab would be responsible for looking at those postcards every 2 to 3 weeks and mailing them out as reminders if we didn't get the FIT test back. So you can go ahead and advance the next slide. And so that's what we would do. The lab would look at every 2 to 3 weeks and either call them or send out a reminder letter and kind of let them know that, hey, we need, this FIT test returned. And then other things we started doing too, to just keep an eye, just really keep it on top of the ones that needed these tests, is running quarterly reports through our QA/QI committee and our care coordinator, and looking at who hasn't had a test ever, who's due for a test, and then or who's due for a colonoscopy as well. So not just the FIT tests, which are for the ones that are average risk, but also colonoscopies for those that probably have had one and are due every 10 years or whatever the recommendations were. So we started looking at those and sending quarterly reminders out to them in the form of a letter or a postcard saying, hey, you're due for your FIT test, or you're due for your colorectal screening, whichever it is. You should make an appointment with the provider, or with your next physical, or with your next appointment. So those are some of the things that we would do. And then calling all of those, what we would call our unmet, so basically the ones that hadn't had the test done. And then what we would do, again, so once they return that test, we would be able to process it. If they were positive, then we put the lab order in for Epic for the provider. The provider would call the patient, and then we would get that, because a follow-up positive FIT test needs a colonoscopy to ensure that it's not a false positive. So that's kind of the next screening piece of it. So then the provider would place the order for a colonoscopy, and we would do the referral for that, get them scheduled, and get them the prep for it, and then the instructions, and notifying the colonoscopy unit at All True Health System, which is where we would do our most, probably 90% of our referrals. Otherwise, other places like Sanford or Riverview, Essentia, those places that have their recommendations for whatever the colonoscopy prep is. And that way, once we had those results, and we would get those mailed out, and then it also goes on their health maintenance, which is in our EMR system, which is Epic. And so that tells us and gives us that reminder that when they're due for their next FIT, when they're due for the next colonoscopy, et cetera. And then the colonoscopy center would then take over from there in ensuring, getting the reminder call when their colonoscopy is due, and then getting the results and whatnot. So go ahead and advance to the next one. And so that's kind of the process that we did for our colonoscopy screenings. And so that way, and for our FIT test or colorectal screenings. And so that way, we know that every nurse that is hired, they get trained on how to do this. Every lab person knows their piece, the front desk knows their piece, the provider knows their piece. So we're all working together as a team, and having the patient in the middle as that patient-centered medical home, so that we can ensure that they're not getting, they're not getting lost, or they're not getting dropped, or things like that. And so one of the other parts, because our Blitz part did not work with doing the flu shots in the community, we decided that during those months, starting in August, September, going through the flu season, we would start doing these FluFITs also during that time. So what we did is we adjusted our flu screening tool and added the FIT test screening questions on there. So you can see on the form up that is up there, we combine them together, and it's now the flu vaccination and FIT screening and consent form. So the first few questions ask about the flu vaccine. So are you sick? Do you have any allergies? So on and so forth. And then the next ones are the screening questions for that FIT test, so they can go ahead and answer it. So the first one is, are you between the ages of 50 and 75? Obviously, if it's a young adult and they're 30 years old, they would answer no and they would be done. But if it was a patient in that age, then they would answer the next questions. And then when the nurse received those forms, whether it be the patient's here for a provider visit and wanting to get their flu shot during that, or if they were strictly here just for a flu visit to get their flu shot with the nurse, they're still able to look at that and say, oh, I see this patient is needing a FIT test, has never had one, and is within the age range. So then we would grab that FIT test along with our flu and go in and take 5 minutes to just go over what the FIT test is, why it's important, and going through all of that. So then you can go ahead and advance to the next one. And then that's just the bottom part of it that we would fill out on the form. So go ahead and advance to the next one. And we use that for, again, to putting it into Epic to ensuring that we know if they were screened, if they weren't screened, if they accepted, because there are some patients that were like, nope, I don't want anything to do with it. I don't want it. So we would put decline, and then that form goes into their chart. And so this is just a little instruction sheet we had made up for our nursing staff to kind of go through what it's for, what the kind of the process to complete it, the questions, the answers to them, and then kind of moving forward what those were. And basically, like I said, it was just a quick 5-minute taking the thing out of the FIT test, the instructions, and going through it, because it's really simple, asking them, do you think you can give this specimen while you're here today? And if not, here's your test. Do you want to drop it off? Would you like us to put postage on it? And then they take it with, and then that process starts over again. And so that's kind of what we've decided to do moving forward. And it's really worked. Like I said, we've gone from the upper 20s, 30s to, somewhere in the 40s overall for a year. But I think this last quarter, we were at about 44%. And hopefully our goal is going to be about at least 50, and just keep advancing those screening rates to get those scores up higher. So that's kind of what we had done. So any questions, just let me know. And I think one more slide. This is the postcard that we had developed. Again, just really simple. We sent it out. On the back would be the patient's address, and it would just go to them, and it would be just a reminder that, hey, you haven't had your colonoscopy screening or your colorectal screening, just give us a call, and then they can call and we can schedule, or they can come and pick up their FIT test or answer their questions. They usually talk to our charge nurse, or they talk to our care coordinator. If they have any questions, if they had more questions than that, we could have them talk to a provider and just send that message through Epic and have them return that phone call. So that's all I have. Thank you.
Yeah.
Thank you so much for that, Betty. With our next presenter, Tinka, if you can advance to the next slide. Our next presenter is from the Turtle Mountain Band of Chippewas. Donna Lundy will be talking about the work that she does. But before we begin on her slides, I want to give a quick shout out because they received an award for the 2020 North Dakota Colorectal Cancer Screening Achievement Awardees. So the Community of the Year, Turtle Mountain Tribal Health and Indian Health Services. The Turtle Mountain Tribal Health Department collaborated with their local Indian Health Services unit in the Quentin Burdick Memorial Healthcare Facility to increase colorectal cancer screening in their community. Public health nurses, labs, and the Government Performance and Resource Act Department worked closely with health educators on the project. So they distributed take-home tests and worked together to track the returns and results. They made a follow-up telephone calls to encourage community members to return their tests since embarking on this project in 2017. They have continued to increase the numbers in the community members screened each year and exceeded their goals set each year for their project. Their team is committed to saving lives for colorectal cancer through screening in their community. So at this time, I will go ahead and turn it over to Donna Lundy with the Turtle Mountain Band of Chippewas.
Donna, can you hear us? Let me see. This is Tinka. Let me see if I can find her. Donna,
You
you
might be.
phone?
Can you hear me?
Yes, we
Yes.
can hear you now.
Okay. Good morning, everyone. My name is Donna Lundy St. Clair. I am the Tribal Health Educator for the Turtle Mountain Tribe. And looking at the PowerPoint, I think I sent the wrong one to you, Eugene, but I can work with it. My assistant is Jolene Kaplan, and I am going to go over the colorectal cancer initiative success story. So next. So the demographics of our area, the Turtle Mountain Agency is located in a little tiny community of Belcourt, North Dakota, which is geographically located in the far north central part of the state. It's approximately 10 miles southeast of the International Peace Garden. The land base of the reservation is entirely in Rolette County, and it only measures 12 miles by 6 miles, 12 miles long by 6 miles wide, with approximately 30,100 enrolled tribal members and about 11,349 living on and near the reservation. Next. So some of the key players that we have are the public health nursing that we have at IHS here, the IHS lab, the Indian Health Service lab, the primary care providers, the physician assistant, our department, tribal health education. We also have IHS surgeon and the Great Plains Tribal Chairman's Health Board. So next. So some of the strategies to increase our colorectal cancer screening were to develop a team. So all of the key players were our team members. We went to the Sky Dancer Casino because they have a free meal every Wednesday of every month. So we met with the manager there and asked if we were able to go up and set up right outside the cafeteria and catch a lot of our seniors at that time. And they agreed to doing that. So we sat up every single second Wednesday of each month and did just that. We didn't do the FluFIT right away. We did, after the first 2 years, we didn't do the FluFIT. We just did the FIT test. And then the second 2 years, we did do the FluFIT. We used some of the things that we did, the tribal health and public health nursing with the colorectal cancer education. What we did was we had a flip chart that was provided to us by the American Cancer Association. And we just sat there and did our education right at the table. Sometimes we would have a group of people. Sometimes we would just have one or two people standing there, and we would just educate at the same time. And while we were educating, we also used brown clay to do a visual for individuals to teach them how to do the take-home FIT test. So that was a good little tool we had as well. We also had the rolling colon that came through every March of every year. We had the rolling colon, a huge walkthrough visual that was also at our events. So the Great Plains, we would request that we would get the rolling colon here in March at that time. So we usually had someone presenting from the Great Plains for us at that time as well. Public health nurses provided like the names, the birth dates to the our physician assistant who would do the lab orders for individuals. So if we had a whole list of, say we had 40 names for one day, she would take that list and put it in the system. Since tribal health does not have access to the system, that the public health nurse did. So she would submit all the names to the physician assistant here, and she would turn around and put all the lab orders in for all of the individuals on the list. And the list would usually have like their birth dates and their phone numbers. So we would also, in the clinic itself, like right here at the hospital, they would have the doctors on a daily basis would also provide fit tests for patients. Oh, next slide, I'm sorry. So the doctor would also provide a fit test in clinic on a daily basis. So if they had a patient that came in that was age 50 or older or 45 or older, they would ask them if they've ever had this test, and if they didn't, they would provide the test for them as well. The public health nurses would set alerts in the electronic health record for individuals that did not bring back their fit test. So they would do a follow-up call with the individuals and ask them to bring their fit test back. So once the patient completed the fit test, they would get a $33 gas card. So, and within a week or so, they would also receive a letter back from the physician assistant indicating if they had a positive or a negative test. So, and if they did have a positive test, they would be set up for colonoscopy here at our facility, because we do have a surgeon on staff that does do the colonoscopies. Next. So there's our little cards that we use. We would have their name, their birth date. We'd also included the date up there. It would have to be signed off by either the doctor, the PA, the nurse, ourselves. And then once they got to lab, they'd have to sign off again on this little card. And then they would bring back, once they completed the fit test, they would bring this little card back to us. Next. So what we did was we received grants 2015, 2016. Our first one was Colorectal Screening Saves Lives. And the grant came from the Northern Plains Comprehensive Cancer Control Program for $5,000. And the name of our grant at that time was Check Your Colon. And the following year was 2016, 2017 was Check Your Colon. I'm sorry. The first one was Colorectal Screening Saves Lives. The second one was Check Your Colon, the Great Plains Colorectal Cancer Screening Initiative for $7,500. Next. I'm kind of going off of two of these. So the following year we received 2017, 2018, Keep Your Colon and Flu Shot in Check. That's when we started incorporating the FluFIT. At that time is when the nurses would actually provide a flu shot for individuals right there while we were sitting there at the casino. We received $10,000 that year. And for all the money that we did get from the Great Plains, was the majority of it was used on the little cards, $33 gas cards. So 2018, 2019, we had FluFIT Saves Lives, Great Plains Colorectal Cancer Screening Initiative of $10,913. Next. So the GPRA, the Government Performance Result Act 2014, we did not get a grant at all. And at the end of the year, we did not meet our target. Our target was 35%, and we only made it up to, 31.5% we did not meet. And then we did get the grant in 2015, and our target was 35.2%. And we screened 770 people out of 2010 with a results of 38.3%. 2016, our GPRA target was 38.7%. We screened 830 individuals out of 2,074 with the results of 40%. Next. So 2017, 2018, GIPRA target was 40.2%. We screened 884 out of 2,078 with results of 42.5%. 2018, our target was 32.6%, screened 933 out of 2,645 with results of 35.33%. 2019, our GIPRA target is 32.6%. And we have exceeded that number before we even started. So I know that we have done a great job by getting these incentive cards out to individuals and having them understand that it's really easy to do the FIT test. So individuals don't even want the card anymore. They're just doing it routinely in the clinic when they come back and see the doctor with their routine visit every year. So they ask the doctor for the FIT test. So that is a good thing too as well. Next slide, please. Love your butt. So, and this is it. If anyone has any questions, I'm more than welcome. Happy to answer anything.
Thank you so much for that, Donna. I appreciate that.
I sent the wrong slide. I sent the wrong one to you.
Totally, you did great.
Thank you.
But I want to give a huge shout out to the Turtle Mountain Band of Chippewas for their achievement award. They've exceeded every expectation that we needed here at Great Plains Tribal Chairman's Health Board with the CRC program. So congratulations to you and your program.
Thank you. Thank you. And I mean, we couldn't have done it without you, because I mean, with these little cards, these gas cards, it made a difference. And just being able to sit down and with Shannon as well, you know, giving us the information, giving us tools to work with, it made it so much easier for us to be able to go out there and work with individuals. So, I mean, we couldn't have done it without you guys either. So thanks a lot.
Thank you so much. Next slide. All right, so the next one that we'll talk about is the Great Plains Colorectal Cancer Screening Initiative FluFIT Toolkit that we at Great Plains Tribal Chairman's Health Board provided. So since the beginning of our initiative that we started with the 5-year grant back in 2015, we delved deep into figuring out what ways that tribal facilities can make these implementations to make their program run smoothly, more effectively, and overall sustainable. So what we came up with was the Great Plains Colorectal Cancer Screening Initiative FluFIT Toolkit Guide that we provide. Also giving a heads up, we worked with multiple organizations and programs that help put together this toolkit guide for the facilities across the Great Plains region. Next slide. Okay, so just to give a background on what to expect with the toolkit, I'm not going to talk too detailed in with the toolkit itself because there's a lot of information in there. I believe it's around 30 pages of toolkit, helpful information for each facility, tribal community to implement the FluFIT program within their facility. But just to give you a heads up, we do talk. The toolkit does talk about the background and benefits of colorectal cancer screening, the criteria for individuals eligible for CRC screening, patient education about CRC and the importance of screening, steps on setting up a FluFIT program in your clinic, staff training regarding implementation with FluFIT program for your clinic, tracking tools to manage your FluFIT program, community health centers logic models for FluFIT program. So with the FluFIT program is an efficient and effective way to increase colorectal cancer screening. The flu shot clinic staff provides take-home FIT kits for patients due for colorectal cancer screening when they get their annual flu shot. Patients due for colorectal cancer screening through the FluFIT are 50 and older and have not had a FIT test or a FOBT test done in the past year of colonoscopy. So the reason why that we wanted to implement this within our tribal facilities and our subawards is because it is a sustainable effort. If at some point any program ends, what the clinic can do is still continue those initiatives with the Great Plains or with the FluFIT program. So also with it is the patient education. So one of the things that Great Plains Tribal Chairman's Health Board tries to do is provide talking points with the patients, facts about colorectal cancer, that it's preventable, and with proper screening, with early detection, treatment, all of that can save lives. And 70% of people diagnosed with colorectal cancer have no symptoms. And these are some of the talking points that we provide with the healthcare facilities, and also facts about the FIT kits. So we also provide the instructions on the FIT test, whether you're using FIT or FOBT, points with use for patients, reminders after giving the patients their kits. Okay, so the next slide. All right, so what is the FluFIT program? So the purpose of the FluFIT program is to increase colorectal cancer screening to men and women who are 50 years older to 75. So when the FluFIT season is here, the flu shot clinics can hand out the FIT kits to the appropriate age patients. So the reason why this is implemented is because that the FluFITs are done annually, as well as the FIT test. So creating that cohesion with both types of, so one of them is screening and one of them is preventative. So a lot of these, so these two efforts go hand in hand with preventative efforts. Next slide. Okay, so why do a FluFIT program? So within this toolkit, it'll talk about the annual cost for colorectal cancer screening are underused. So colorectal cancer is the third leading cause of cancer-related deaths in the Great Plains tribes. So many of these deaths can be prevented with routine screening. The least invasive and less expensive form of screening involves the annual stool tests using their high-sensitive guaiac-based fecal occult blood testing, or the fecal immunochemical testing. If screening is done annually with the consistent follow-up with the FOBT and the FIT, it can prevent colorectal cancer or catch it at an early stage when it's more easily treated and most successful. The annual FluFIT activities provide an opportunity to reach people who need colorectal cancer screening. So every fall, the Great Plains Tribal Clinics and the Indian Health Services clinics give out flu shots in their communities. Many of these people are at high risk for colorectal cancer. Targeting annual flu shot campaigns is an opportunity to reach these at risk for the group of colorectal cancer screening. Also within this toolkit is the FIT kits can be given to patients within the flu shot clinic staff, and it kind of gives a little bit of an overview with that, along with the FluFIT program increasing colorectal cancer screening rates. Also within it is the FluFIT program can be a first step towards the innovative preventive health and screening programs. So successful FluFIT programs can lead to other practices, innovations such as adding on smoking cessations, referrals, or even mammograms. The FluFIT program can help meet important performance goals. So the FluFIT is an evidence-based intervention that has been shown to help organizations increase colorectal cancer screening rates, thus helping these health systems meet important performance goals and improve quality measures. Next slide. Okay, so the 5 simple step process. So assembling together your FluFIT team. So within the toolkit, it'll provide information on selecting a FluFIT champion to coordinate your efforts. Since I've been in the program with Great Plains Colorectal Cancer Screening Initiative, we've noticed that each community will have a champion coordinator to help lead those efforts and help boost those screening rates and lower the incidence of colorectal cancer. So selecting your FluFIT team member and staffing levels, and also choose time and place for FluFIT and advertise them. So with the toolkit, it'll also provide when to start, where to do it, and advertising it. Patient flow in line management. So this will offer fit in line before giving out the flu shot, and it'll talk more in depth on why that would be more of a important factor when implementing the FluFIT. Also assessing eligibility for the FluFIT and developing systems to support follow-up on the fit kits dispensed. And this will also dive deep, considering the ease of test completion when selecting the fit kit, and also providing a return envelope for kits to be mailed out back to your clinic or the lab. Also, this provides assistant patients with abnormal fit results to get colonoscopies in addition to treatment when needed. And the final preparation, so gathering your supplies well in advance, 2 weeks before the FluFIT activity starts, and also diving more deep into your first day of your FluFIT program. Next slide. So the 5 key elements for your FluFIT staffing. One thing that I like about the toolkit is that it provides more in-depth detail on these types of implementations. So information about the importance of both flu shots and colorectal cancer. So what this will do is it'll provide facts that your staff can know about flu, and also with the types of CRC screening with FIT and FOBT, and also information about how to organize your workflow efficiency, assessing eligibility for flu shots and FIT without waiting for a doctor order, talking to patients about how to complete the test, and also information about how to record your work and provide follow-up of the FIT kits provided for patients. Next slide. So one of the things that I like about the toolkit is that it does provide useful tools for each facility or clinic that are wanting to utilize the FluFIT program. So one of this is the FluFIT components and logic model. Within this logic model, it's going to talk about a process on how the operation can be carried out with the FluFIT program. Next slide. So next is clinician's reference. So what this will talk about is if your clinician needs any type of reference with the types of screening to provide for each patient, whether that's between the ages of 50 and 75, whether they want to utilize the FIT testing or the FOBT testing. Next slide. So the next slide also provides, so within the toolkit, it also provides a tracking sheet. Now this is very helpful for facilities that are first starting out and how to track their FIT testing or their FOBT testing. Well, this will provide a patient name, their phone number, the date FIT completed, results, whether that's negative or positive, the name of the patient care provider, and also the date notified, as well as the colonoscopy scheduled and if it's completed or not. Next slide. So the FluFIT flow chart, if you click a couple more times, Tinka, it'll bring up the flow chart. So this is what we provided with a lot of our tribal facilities within the Great Plains region. And since I've been working with the Great Plains Colorectal Cancer Screening Initiative and making site visits with each facility, we've always noticed that almost each facility within their providers, they will have these posted within their office, within their building. This is a helpful reminder on when to implement the FluFIT testing, whether that's a negative or positive, and it dives deeper into that on steps on how to go about this. Next slide. So the checklist, and this is another thing that is also provided within the toolkit itself. One thing I like about this is it talks about each step, you know, what you need to check off, whether that's assembling your team involved with everyone in the planning process, designing a coordinator, selecting team members. It also dives deep into the type of members that you need. So this is the tribal health educators, physicians, the public health nurses, lab technician, and community health representatives. It also talks about the plan and implementation of your program, the steps that you need in place. If you need this checklist, it's also provided within the toolkit. It also talks about a designated dates and times of the location, developing systems to support and follow up, and the finished preparation of your FluFIT program. Next slide. So also within the toolkit itself is the action plan activities. So the action plan activities. So what this does is it provides a template for our subawardees, our facilities, clinicians to provide, you know, a type of action plan that's set in place for their FluFIT program initiatives, and it lays it out for you so that you'll be able to follow each step and step. Whoever's staffing within this program itself, whenever the dates to be completed, notes, and if it's completed or not. Next slide. So the consent form is also a form that facilities can utilize, and they can also tweak this form to fit the needs of their facility. So it is a living document so that you would be able to pull up this document. You can change up the wordings, whatever will be useful to meet the needs of your facility. Next slide. It also provides a telephone script. This is just kind of broad, so we also provide these to our subawardees, our facilities, if they need a telescript to help lead the calls. This is a living document too that can be changed as well. Next slide. Is the FluFIT program calendar, and this is also within the toolkit itself. Now this will talk step by step with each month in the beginning process of implementing your FluFIT program. It'll go through each month on the steps that you need, starting from February all the way up into December, January, February, March, and all the rest of the months following after that. Next slide. Also, what this toolkit provides is flyer templates. So a lot of the FluFIT programs that are being implemented need advertisements. So what this will provide is a blank template for facilities to utilize whenever they want to implement their program itself. So it'll talk about the who's, the what's, the when's, the time, and where of the facility. Next slide. So I also want to mention that we do have the FluFIT toolkit that is provided with Great Plains Tribal Chairman's Health Board, and also with other resources that are within this webinar. We can provide those after the call. So thank you once again for those who joined the GP regional FluFIT call, and at this time we'll open it up to any questions that anyone has.
So I've unmuted everybody. You still may be muted and might have to manually unmute yourself, but you do have access to unmute yourself if you'd like a question to answer or ask a question, or you can also type in the chat box. Eugene, there was one, Eugene and Shannon and presenters. I think this is specifically to Eugene. There was a question in the chat box. Is it possible to receive the FluFIT flow chart after the meeting today? Great flow. This is from Aaron Sweezy.
Yeah, for sure. And we do have a registration link with all the people that did attend. So what I can do is I will send out the presentation itself along with the flow chart and more importantly, the toolkit that can be provided to each member or facility with that who joined in with this call.
Okay. Is there any other questions? So there's an email from Kendra Zellers. How did you determine the $33 for the gas card? I think that might be to Donna or to Eugene.
Hello.
Hi, the question is, how did you determine $33 for the gas card? This is from Kendra.
It was what was allowable. The Great Plains indicated that we were allowed to use the only go up to $33. So that's what we did, was use the $33 amount.
Eugene, do you have anything to add to that?
Just to touch more base on that. So with our funder, the Center for Disease Control, we were allotted so much monies to be spent within each tribal facility. So whenever we received an application and approved that subaward for their total amount, what we did is we sent out a request for applications for those that wanted to apply for the program. So based on what was applied, we allotted a set amount for each subaward that can be awarded up to. Within their application, we based that on the total amount that they were funded.
Okay. I have a few questions in the chat. The next one is, do you have health centers that are not able to access colonoscopies as easily? Our biggest barriers is follow-up to the screening. Maybe that's open to all the presenters. Is anybody that would like to answer that? This is from Alex Bakey. I may not be pronouncing your last name right, but first name is Alex.
Hi, this is Eugene Gallego. Since working with the program with Colorectal Cancer Screening Initiative within the 4-state region, which is North Dakota, South Dakota, Nebraska, and a small section of Iowa, we noticed that a lot of those facilities are having that issue, and some of them do have an in-house colonoscopy. So it varies within each tribal facility. So, and that's one of the things that we try to establish and kind of work with each subaward is reducing those structural barriers. So that's another effort that we provided within our initiatives that we've done. So, and a lot of programs, what they'll do is that they'll get that assistance through their tribe itself. So one of them was in between South Dakota and North Dakota. They would have to drive, I believe it was an hour for their colonoscopy, and the tribal facility, the tribe itself was able to provide funding for that. So a lot of those facilities can drive back so those patients can drive back and forth for that.
This is Shannon. That's definitely a challenge that there's been a lot of discussion around. One thing to check into, if you haven't, is just Medicaid and Medicaid expansion in your state and what they might cover in terms of transportation. I know in North Dakota there's some assistance available. So if you do have patients who also are on traditional Medicaid or Medicaid expansion, maybe to see what state level support might be there.
Great, thank you. There's A couple thank yous. Thank you. That would be great to get the paperwork. Another person said thank you. There's a question. What is the cost of the FIT kit? Is this acceptable for Medicare compared to the Cologuard test? This is from Susan Schleck. So what is the cost of the FIT kit? Is this acceptable with Medicare compared to the Cologuard test?
Shannon, did you want to touch base on that?
I was just waiting to see if you did. So I hesitate to throw out any specific numbers, and maybe some of the facilities on the line would know too. I've heard sometimes the FIT kit may be around $20. And then in terms of Medicare, I believe that Medicare is covering Cologuard or the traditional FIT. And Cologuard, if it were to be paid for out of pocket, would be significantly more expensive. But my understanding is it's covered by Medicare. I can double check, and if that's not the case, I can email Eugene to send an update.
It's 11:01. Are there any other questions for the presenters?
This is Donna Lundy. I'm back on the line.
Hi,
It just so happened our office phones went dead, So I don't know if I missed anything.
I think you
Are there any questions?
I think
Okay.
you answered the
Okay.
$50 gas card, but is there any other questions
Okay.
for the panelists?
I know I heard something about the FIT test, who was paying for it. I know for our facility, IHS pays 100% of the FIT test here.
Great. Eugene, we're like 2 minutes over. Do you want to go ahead and close it out then if there's no other questions?
Yes. Once again, this call is recorded. So what we can do is upload it and send out the link for those that participated and those that feel that this information would be useful to others. You could send it out. And also, we will be providing the PowerPoint and other useful tools within this. Once again, I want to thank everyone for joining this call, and we'll see you all later.
I think real quick, there's also evaluation questions that will be sent out to you after the end of this presentation. If you could fill that out and for us, that would be great. It should come in an email and a link to fill out the evaluation questions. We'd appreciate if you would complete those for us. Thank you.
Yes, thank you, Tinka.
Thank you.
Thanks. Bye-bye.
Thanks, everybody. Bye.